This is the knee joint which you see on the x-rays. And if you see that the femur is the largest bone of the body, and when it ends towards the knee joint, it makes into two condyles. It is divided into two. Then it goes on the tibia. The tibia is the next bone, which is the lower part of the knee joint, and it is supported on the outer side by a bone called fibula. So the result is that this lateral side of the joint is not so much eroded as much as the medial side is eroded. Now that is not the end, because it is not the bone-to-bone friction that the Creator has made, but there is a synovial fluid inside it, and this synovial fluid is the lubricant and the nutritional part of the joints that are taking place and the cartilage. After this, then if you see there are further protective mechanisms in between these bones, which are called the meniscus, and these meniscus are in between, like shock absorber, which the hockey players generally break so that the bone doesn't hit the bone. After the bone, this shock absorber, there is also a cartilaginous surface on the top of the lower end of the femur and the upper end of the tibia. The net result is the knee joint is beautifully made, and it has got various types of protective mechanisms, like there is the lateral ligament, which will not let the knee joint to move medially, and the medial ligament, which will not allow the joint to move laterally. So this is a beautiful and structure. Furthermore, the positional sense of the body is maintained by the knee joint. That means if we are slipping or we are going up and down the stairs, this will give you also the proprioceptive mechanism of the knee joint.